bringing the total number of confirmed cases in our country to 8. Of the 5 new positive cases, 3 arrived from the United States, while 2 came from the United Kingdom. We are still collating information on the travelers, but we know that 2 of the 3 from the United States are Nigerian, a mother and her child, making this 6-week-old baby the youngest COVID-19 patient we have. And the 3rd person is an American national who crossed the land border and became the first COVID-19 case who did not arrive by air. The 2 cases from the United Kingdom are Nigerians. A detailed travel history of each person is still being compiled, and contacts are currently being traced to identify persons who have recently been in touch with any one of them. The National Emergency Operations Center, led by the Nigeria Center for Disease Control and supported by partners, is carrying out the response in all the states. The federal government, through the Ministry of Health, is conducting the risk assessment to help to guide decision-making. We urge Nigerians not to panic, but to allow experts in the public health space to guide the response in a calculated, scientific manner. False information and rumors to cause fear and panic must be avoided at such times. The COVID-19 cases so far appear to have mild symptoms and are all under treatment. To protect yourselves and your families, I urge everyone again to continue to take care and caution as advised by the Ministry of Health. The government will do the needful to protect citizens' health. The Presidential Task Force for the Control of Coronavirus, COVID-19, has announced the following interventions on the 17th of March and also this morning. First, the prohibition of travel by all public servants. Secondly, the suspension of the visa on arrival policy until further notice. Thirdly, a firm travel advisory to Nigerians against non-essential travel to high-burden countries, especially in view of the number of Nigerians who have arrived from the US and Europe and diagnosed in the past 48 hours with coronavirus infection. Number 4, a requirement that all persons returning from overseas will self-isolate for observation for 14 days, even if they feel very well. The NCDC will disseminate information on the practice of self-isolation. Number 5, a supervised self-isolation, including testing of persons returning from nations with community transmission of more than 1,000 cases cumulatively for 14 days will be conducted by the Nigeria Center for Disease Control and Port Health Services. Number 6, federal government will restrict entry to Nigeria of persons from the listed high-burden countries with effect from Friday, March 20th, for a period of 4 weeks initially and subject to review. Number 7, a reminder that citizens maintain hand hygiene and standard respiratory etiquette. The Federal Ministry of Health, through the Nigeria Center of Disease Control, will continue to provide accurate and reliable updates as and when they are available, and we shall take measures to control the spread of infectious disease outbreaks in Nigeria.